philosophy of the Pause, Reflect, Heal Act is basically, in a nutshell, our new philosophy at Lake Health is for the healthcare practitioners to leave all of their negative feelings out before they go into the room to take care of the patient. So that's why it says Pause, Reflect, Heal.
Hello, my name is Eric New, here for Get Healthy Perry. Today I'm here with Sharon Minjarez, Director of Lake Health Wellness Institute, to explain more about the Wellness Institute and some of the programs they run. Hello, Ms. Minjarez. Thanks for joining us here today.
It's good to be here, Eric.
Lake Health Wellness Institute.
The Lake Health Wellness Institute is a complement to Tri-Point Medical Center, which opened last October. We have now shifted from treating patients in a traditional episodic concept, which means in the past we would have treated a patient that came in for hypertension. Now what we're going to do is we are going to treat them as a whole person, meaning we're going to look at their body, their mind, and their spirit too. Okay.
Can you tell me the mission of the program?
The mission of the program basically is to provide evidence-based modalities that will promote health and wellness of each patient.
Oh, so can you explain the concept of like integrative medicine?
Sure. The concept of integrative medicine, as I mentioned earlier, that we had talked about in the past, we used to treat patients for the disease state that they were, admitted into the hospital with. Now what we'll do is, let's say a patient comes in with hypertension, they will be given, for example, a drug to help lower their blood pressure. The doctor then will say, okay, let's look at your diet. Do you need to see a dietitian? You seem to be maybe a little bit overweight. Maybe we can recommend you into an exercise program, and you seem a little bit stressed. Then we're going to refer you to the Wellness Institute, and they have yoga classes that can help reduce your stress.
So what programs does the Lake Health Wellness Institute offer in order to help our communities with weight management? We
have several different programs in weight and I'm sorry. We have several different programs involved with weight management. One of them is our Weight for Life program, which is a 10-week program that is run twice a year. Basically, it's 2 hours a week of exercise and 1 hour a week of nutrition lecture. The nutrition lectures are led by a dietitian, and the exercise component is led by a master degreed exercise physiologist. We also have what we call medical nutrition therapy, and that's basically, in layman's term, that's when you would come in, see a dietitian on one-on-one and try to, let's say, lose weight, lower your blood pressure, lower your cholesterol. Yeah. We also have OptiFast, which is a very low-calorie diet that's run by our medical director of weight management, which is Dr. Barbara Berkeley. And that's a liquid diet, and that's for patients typically that have 50 pounds or more to lose weight.
What is the Healthy Heart School program?
The Healthy Heart School program actually has been in existence for about 17 years. Basically, that's a health education program that involves nutrition and education. And we have been here in Perry, at this point, with the students in Perry, K through 12 are actually involved with the program. So typically it's a nutrition and an exercise component with each grade as we go. And typically we have a pre and a post test too. So our ultimate goal is to address the rising rate of obesity in students, as well as to make them aware of the importance of a healthy lifestyle.
What do you think is the primary reason for the rise in obesity in our nation?
That's a good question. If you look nowadays, you're looking at probably with children, about 15% of children are obese or overweight, and that's pretty sad. I mean, when we come to schools and we see the kids that are in 3rd grade that can't even run 1 or 2 laps in a gym, that's pretty sad. Yeah. So basically we're looking at, there's too many convenience items out there. In other words, we're not as active as we used to be. I mean, who now opens up a garage door, getting out of the car and opens it up manually? We all have remotes, same with the TVs and that. We have a lot of computer games, a lot of things, there's a lot of techie things where we're sitting versus moving and that, as well as we not only have to talk about the exercise, we need to talk also about the nutrition component. We have moved away from what I would consider a whole foods diet, which is eating foods that, come out of the ground, more fruits and vegetables and that. And probably like in your age group, there's a lot of convenience foods and there's a lot of fast food and that, and we really need to try to shift away from that.
What do you think is the best way to promote a healthy lifestyle to the citizens of our community?
I would say, you know what, you need to look at yourself, sit down, regardless of what your age is, sit down and say, okay, where can I make some healthy changes? Do I need to exercise more? Do I need to look closer at my diet? Do I need to set some goals? And when you set goals, you need to sit there and say, okay, they need to be goals that I can obtain, small, sustainable goals. And once you've met them, then you sit down again and relook at it and then set some more goals.
What are some simple steps a person can take to begin changing to a healthier lifestyle?
I would basically, just like as I mentioned earlier, is to sit down and look at what they're doing and make some changes. Everybody can make some changes. We need to move more. We sit too much. You know, again, go back to the convenience items and that, and all of the computer items that are out there. We need to get up and move, and then also start looking closer at our diet.
Well, Ms. Minjarez, thanks again for joining us here today.
I enjoyed being here, Eric. Thank you.
For Get Healthy Perry, I'm Eric New.